Hello friends, this is Dr. Deepu Changappa. Today I will let you know regarding paracetamol. So what is paracetamol? Paracetamol is nothing but a drug. The generic name of which is itself is paracetamol. It's commonly called as PCM. You might have noticed in so many prescription they mention PCM. Alternatively in western countries they call it as acetaminophen. And how it is pronounced? Paracetamol is pronounced as paracetamol. So it's pronounced as paracetamol. Anyhow, we don't use the term acetaminophen in India, so we are not bothered regarding that. If you ask acetaminophen in India, in anywhere in the drugstore also, they don't know what is acetaminophen. And then paracetamol is commonly prescribed to relieve pain and fever. Proper mechanism of action is not known. Paracetamol treats the following conditions like headache, fever and cold, muscle ache, arthritis, backache and toothache. And it is not used to treat inflammation and swelling of joints. Usually inflammation is because of chemical mediators which are present in the site of injury. So paracetamol can't be used to treat such conditions. So it has a very poor evidence to relieve pain in children. It is mainly sold in combination with other ingredients in cold medications. It is most common medicine for fever and pain in US, Europe and Asia. So many companies are producing paracetamol under various brand names. It is not particularly mentioned in the whole list of brand name. If you see the WHO list, you can't get all the brand names you use, but definitely different countries have different brands of paracetamol. So the WHO has recommended dosage of paracetamol for all the individuals. Dose would be different for adults and children. It is dangerous to take this medication more than the recommended dosages. For adults it will be 1 gram per dose maximum. So you can take up to 4 grams per day. In India it is available in the dosage of 500 milligrams, 650 milligrams and 1 gram tablets. So if you are taking 1 gram tablet, you can take up to 4 tablets per day, not more than 4 tablets. So usually my recommendation would be you should take only 4 tablets of 650 milligrams per day, because most of we Indians are weigh about 60 kilos, not more than 60 to 80 kilos is our range, and westerners weigh more than us, so 1 gram would be sufficient for them. So the more or the higher dose of paracetamol leads to serious damage to the liver or injury to the liver. While taking paracetamol, I will advise you to avoid the alcohol if you are addicted to alcohol, because the thing is, since alcohol is also metabolized in the liver and paracetamol is also metabolized in the liver, when both are given together there are chances that you might suffer from serious liver injuries. So also the paracetamol can cause liver disease. So alcohol with paracetamol can cause alcoholic liver disease faster than only alcohol can do. Currently in the market, paracetamol is blended with other medications. Without consulting your doctor or pharmacist, do not take any medications having paracetamol as one of the ingredients. So sometimes intentionally or accidentally we might consume a large dose of paracetamol uh, along with these medications. So we will have an overdose of paracetamol. So overdose of paracetamol can cause severe liver injury. So if you take more than 400 milligrams daily dose of paracetamol, it can cause severe damage of liver and the kidneys. So how to use paracetamol? The use of paracetamol is usually given on the label or strip along with the dispensed medications, or else if it is not there, please consult your doctor or pharmacist about it, how to take this. So the paracetamol is available in the following forms. It is available as a tablet. Tablets are usually taken with water and it is swallowed once in a whole as a whole, and it's also used or available as a disintegrating tablets. First disintegrate the whole tablet in a glass of water and we should drink it. Make sure your hand must be dry while handling disintegrating tablets, or else what happens, a part of paracetamol can get adhered to your wet fingers and it can go waste, and sometimes it's available as a chewable tablet also. So how we should use it? Chew the tablet thoroughly till it disappears in the mouth. And we have an extended release tablet, so it means a prolonged release will be there. The tablet should be swallowed as a whole with water. Do not break extended release tablet while taking. This is the mistake what we make. Suppose a doctor has prescribed 500 mg of tablets paracetamol. It is extended release tablet, might be. So what, you buy a 1 gram tablet and then you take half. If it is extended release tablet, the problem is we are damaging the coating of this tablet, so the delivery won't be slow, it gets released rapidly. And sometimes it is used as effervescent tablet. In that case, dissolve whole tablet in a glass of water and drink it. And sometimes as effervescent granule, dissolve 1 packet of granules in glass of water and you can drink it. And for pediatric age group, it's available as syrup, suspension and solutions. Take directed dose in teaspoon or a tablespoon. If you need water, drink half glass of water after taking medicines. If your dosage form is suspension, you need to shake well the medicine before using it. If it's in syrup or solution form, no need to shake it. If it's a powdered form, dissolve powder in a glass of water and you can drink it. And occasionally this paracetamol is used as suppository. Suppose there is a pediatric patient who is not able to take orally, and what we do is we put suppository into the anal or rectal route, and it will melt due to body temperature. And before putting the suppository, the hand should be cleaned properly. It's in the capsule form. Swallow whole capsule at once with water. Do not take powder out from the capsule and take it. If it's intravenous injection, this dosage form will be given by the registered medical practitioner or nurses only. It should be given directly to your veins and it can't be taken at home or in an outpatient setting. So as we said, there are so many brands of paracetamol available in the current world market. Before taking paracetamol dosing, you should read the leaflet very carefully. If you need to give paracetamol to the children, make sure that the medicine must be meant for pediatric use only, because pediatric dose contains very less medications for a prescribed ml of the medicine suspension or syrup. So very important to note is, do not break the tablets and use it. Do not touch the capsule if your hands are wet, and self injection should not be done. It can cause so many problems. So for paracetamol use in children, as we earlier said, that before using paracetamol for children, make sure that the product is meant for children only. Use paracetamol to treat fever and pain in children over 2 months old. It's usually not given for children less than 2 months of age. High dose is not recommended for patients younger than 16 years of age. Before giving paracetamol to children, read the information leaflet carefully which comes along with the medication. So the correct dose of paracetamol in children will depend on the following 3 things. One is the child's age, second is the child's weight, and strength of paracetamol in medicines. The recommended dosage for children is 10 to 15 milligram per kg of body weight. For example, if the weight of the child is 10 kg, dose should be within 100 to 150 milligrams. So what precautions we should take while using it in the children? Do not give paracetamol in children below 2 months of age. First preference should be syrup or suspension while giving it to the children. The doctor should be consulted, or pharmacist or physician should be consulted before giving it to the children. If weight of the child is less than 5 kgs or more than 40 kgs, the doctor should be consulted regarding the dosage of paracetamol. And recommended dosage of paracetamol for children of all ages. What are these? What does WHO says? For adults, it is 500 milligrams to 1 gram. This dose is required after every 4 to 6 hours. Maximum 4 dose per day. 2 gram to 4 grams per day. For children aged 12 to 16 years, 480 to 750 milligram required after every 4 to 6 hours. Maximum 4 dose during the day. And for children aged 10 to 12 years, 480 to 500 milligrams required every 4 to 6 hours, maximum 4 doses during the day. And for children aged 8 to 10 years, 360 to 375 milligrams required every 4 to 6 hours, and the maximum as usual 4 doses during the day. And for 6 to 8 years, 240 to 250 milligrams, and for aged 4 to 6 years, 240 milligrams every 4 to 6 hours, and for aged 2 to 4 years up to 180 milligrams required every 4 to 6 hours. The dosage maximum allowed will be 4 times per day. And recommended doses for 6 months to 2 years up to 120 milligrams after every 4 to 6 hourly, maximum 4 dose during the day. Aged 3 to 6 months, 50 to 70 milligram every 4 to 6 hourly, and for aged 2 to 3 months, 40 to 60 milligram required every 4 to 6 hours, and maximum dosage 4 times per day. And below 2 years of age, the paracetamol is usually not recommended. Consult your doctor if you are planning to use paracetamol in a child aged less than 2 years. And we should note that for fever and pain management, dose of paracetamol will be same for children and adult. So if you take paracetamol on regular basis and miss the dose, either consult your doctor or pharmacist or skip the missed dose. If you have missed the dose, don't take missed dose with the next dose. It may cause excess gastritis, sometimes nausea, and also vomiting. Be careful with this. And what are the, we should know when you take paracetamol, we should be aware regarding the first sign of paracetamol overdose. One is loss of appetite, that is unable to eat the food, and then nausea, vomiting, stomach pain, confusion and weakness, sweating. These are the earliest sign of paracetamol overdose. Some later symptoms, that is when the disease has progressed, you can get pain in the upper abdomen, there might be a dark urine, yellowing of the skin, and then yellowing of your sclera, that is eyes will become yellowish. So these are the signs of paracetamol poisoning. And then if paracetamol is taken in recommendation, it's a very safe medicine for adults, but if the dose exceeds, it will cause some of the side effects like liver damage. Overdose of paracetamol often causes liver damage, that is it can be a moderate to severe disease. In Western world, paracetamol toxicity is the foremost cause of liver failure. So you should be very careful while taking paracetamol not to pop paracetamol whenever you get a fever, whenever you get a body ache, or you are not feeling well, you are not feeling asleep. So these are the problems of taking paracetamol. You might suffer from severe liver damage. Second one is there can be skin reactions. So the paracetamol can cause skin reactions very rarely, but overdose of paracetamol may convert it into moderate to severe. Except normal skin reaction, it was reported that following two problems may be occurring due to overdose of paracetamol. One is toxic epidermal necrosis. The second one is Steven-Johnson syndrome. Steven-Johnson syndrome is, it involves the mucosa bleb will be there, and skin also will develop blebs, and toxic epidermal necrosis also similar thing. It will spare the mucosa, but it will involve the skin where there will be blebs on your skin. And then some of the other unusual side effects are as follows: nausea, vomiting, stomach pain, loss of appetite, dark urine, yellowish skin. Some studies also suggest that there is a relationship between paracetamol and slight decrease in the renal cancer. And what precautions should be taken before using paracetamol? Do not give paracetamol to children less than 2 months of age without asking your doctor. Paracetamol should be given based on the weight of the child. The dosage should be calculated based on the weight of your child. Paracetamol is safe for old aged patients, but still you should take care about dose calculation of paracetamol in old age. And paracetamol by oral route is categorized in category B by FDA during pregnancy. So it is safe to use paracetamol during pregnancy, but you should take care about dose, and you should consult your doctor or pharmacist before using it. And then paracetamol by intravenous use is categorized as category C by FDA during pregnancy. Studies suggest that it will cause harm which will affect the unborn child during pregnancy. You should take care about dose and route of administration of paracetamol during pregnancy. Or take precaution if you are a lactating woman or a breastfeeding woman. Paracetamol is excreted in breast milk, but it is in a very small quantity. American Society of Pediatrics categorized the paracetamol as very safe drug during lactation, but you should be careful while taking paracetamol during breastfeeding. Precaution should be taken if you are alcoholic and having liver related disorders, because it might aggravate the liver failure. If you are currently associated with use of other medications while taking paracetamol, you should be very careful about it. So, do not take a dose of paracetamol if you are already allergic to the paracetamol. If you have any other allergies like to preservatives or animals or products of milk products, consult your doctor or pharmacist before taking paracetamol. Special precautions should be taken if you have kidney related problems while taking paracetamol, because it falls under category of NSAIDs. NSAIDs can cause renal trauma or renal injury. Small interactions with other medications is classified under three categories. One is major drug interaction to moderate drug interaction. It is moderately clinically significant. Minor drug interactions, it is minimally clinically significant. Risk is very low if paracetamol is taken with other medications. So, paracetamol interaction with other medications, there are 12 drugs which is found to have major interaction with paracetamol. One is alcohol, and then alcohol 5% in dextrose 5%, alcohol and dextrose injection, amyl nitrate or sodium nitrate, leflunomide, teriflunomide, epinephrine, cyanide antidote kit, prelocaine, lidocaine topical solution. You should avoid these medications when you are taking paracetamol, or should not take paracetamol while using these drugs. Some anticonvulsants have interactions with paracetamols like amobarbital, butalbital, pentobarbital, phenobarbital, cicobarbital and carbamazepine. With these anticonvulsant drugs, paracetamol will increase the risk of liver injury. And non-narcotic analgesics like diflunisal have some interaction with paracetamol. It increases the level of paracetamol in plasma by 50% by inhibiting the breakdown. So, and then isoniazid, anti-tubercular drug, having drug interactions with paracetamol. So, you should just decrease the dose of paracetamol in these cases. Warfarin blood thinner will also interact with paracetamol and increase the risk of uncontrolled bleeding. Certain cholesterol lowering agents like cholestyramine decreases the pharmacological effects of the paracetamol. So, when paracetamol is taken under direction of the doctor and the recommendation, it is extremely safe medication. Paracetamol overdose may be due to single intentional or accidental one-time overdosage. One main reason behind it is multiple consumption of medicines having paracetamol, especially when you are taking over the counter medications. Some drugs like carbamazepine, phenobarbital, primidone, rifampicin, etc. alter the metabolism of paracetamol, and it may cause overdose of paracetamol. A person who is taking one or more of these medications, they should avoid using paracetamol. Simply 10 to 15 grams of consumption of paracetamol may cause overdose, and it may cause severe effects as follows: anorexia, paleness, nausea, vomiting, irritability, sweating, stomach pain, abdominal pain, liver damage, kidney damage, etc. And then treatment, how to treat paracetamol overdose. If you think you have multiple dose of paracetamol more than the recommended dosage, you should inform your doctor or pharmacist or do immediate contact of the nearest hospital. Immediate action towards paracetamol overdose is necessary. N-acetylcysteine may be prescribed for primary treatment of paracetamol overdose. This antidote is only effective before 24 hours of overdose. After 24 hours, it will not be effective. If case in severe, then hepatic functions might fail, and it may lead to liver failure, and supportive care for liver will be started. In case of liver failure, transplantation might be necessary. So, better be careful while taking high doses of paracetamol. And then in what conditions we can use paracetamol? We can use it in fever, pain, osteoarthritis and lower back pain, headache, toothache, menstrual period pain, cold and flu pain, that is headache due to cold and body ache due to flu. And then the paracetamol can also be available with these combinations. Just it can be used along with diclofenac sodium, cerebropeptidase, aceclofenac, ibuprofen, nimesulide, dicyclomine, mefenamic acid, caffeine, aceclofenac, and tizanidine, muscle relaxant, domperidone, antiemetic, promethazine, diclofenac sodium, tramadol. These are the combination of drugs. You can see, as you can see, lots of drugs are used along with paracetamol. Hope this presentation will open your eyes regarding the usage of paracetamol, and hope no one takes over the counter paracetamol as and when required. Please decrease the intake of paracetamol if you are really not ill, because overdose might lead to further liver failure and so many other complications. Thank you. Thanks for watching this video. If you like the video, please don't forget to subscribe to my channel. Thank you.